upcoming exam. This is not like the upcoming exam, but yes, maybe next year, maybe your FAT exam, maybe for some other exams that you are preparing in critical care. So this course that we have planned and started from last, I would say, 2 years, it is completely aimed to help you at every step of your the training period. So maybe first year, maybe second year, maybe third year, and also for cracking different critical care exams, because here we are trying to clear the concepts. So this is the beauty of this course, where every candidate can be benefited. So there are candidates joining, so hopefully we should be giving some more time. Darshan, this is my personal feeling.
Yes, sir, definitely, sir. They are increasing
Yeah.
by
Good evening, good afternoon, and welcome to this very unique theory, OSCE, and practical course introductory webinar, specifically designed by 360 Critical Care Academy. And this would be for the preparation exclusively for DRNB and DM, which are the topmost critical care training in India. And this course is not only for the DRNB and DM. So if any candidate who is currently getting training in either DRNB and DM first year, second year, they can also join this course to get the idea how to know how to get the different the strategies to write the theory paper very efficiently and impactfully. And also some of the candidates who are also in some other courses, they can join to get the complete comprehensive coverage of the critical care vast topics. So with this, I welcome my co-faculties for the course, Dr. Darshan Prakash, who is the consultant intensivist at the Baptist Hospital, Bangalore. Very dynamic, and I would say one of the rising stars in critical care in all over India. With Dr. Darshan, I also welcome Dr. Niharika, the lady power, and I would say again the top-notch intensivist, upcoming star, again in the Indian sky, critical care sky. With this, if I miss Dr. Srihari Rajkumar, he is the consultant intensivist from Coimbatore, and also Dr. Bhuvneswari Kumari. She is the consultant intensivist at Abu Dhabi. So they have all given their best efforts to make this course very impactful and very comprehensive, very well appreciated in last two of our course that we have conducted, and almost 99% people have cleared their theory exam, specifically if we will be targeting the exam point of view. And we got very rave responses from all the candidates, I would say, both from the theory as well as the practical, because we have done the theory and practical for last two sessions and very well appreciated by everyone. Now with this background, I also, if Dr. Sanant Das is here, he's from Australia, he's the course co-director. And as there is the time difference is like almost 5 hours, so he has not joined, but again, welcome Dr. Sanant also to this online webinar. Now, the aims and objective, why we have thought about this course, the details would be discussed by Dr. Darshan following my presentation. We all know that critical care before it was a subspecialty, but gradually, as the years passed out like by, for last 10 years or 15 years, it has grown leaps and bounds, and now it is a clear-cut super specialty and ever growing. So naturally, as the critical care is evolving, so the examinations and the training are also getting more comprehensive. And when we are talking about the exit exams, so they are getting more and more difficult. And if you will specifically emphasize on the exam course contents, so they need proper the structure, so that the candidates should be able to pass the exams. So for that, if one candidate has to be ready to pass the exam or clear the exam, so definitely the preparation before the exam, that needs to be guided well, and that has to be started early for the success. Now, I'm just giving away like no the snapshot that there are many exams in the DRNB and DM critical care exams like FAT exam, which is the like intermittent the exams that normally the national board conducts in the different hospitals. Then the theory exam and the practical exams. We are specifically today discussing about the theory exam, and I will not take much of your time because the exact exam pattern, the expectations from the examiner, how you should start preparing. I am handing over the discussion to Dr. Darshan Prakash to discuss in detail. Then I will again join for like taking one case, how one should be like no writing in the theory proper exam. So with this, I invite Dr. Darshan to please take over.
Thank you, sir. So, good evening, everyone, and once again, welcome you all to the top course for DRNB and DM Critical Care. So, as Sir was telling, things are getting more and more. The game is upping on, so that's how we need to look at our present scenario. So, it is a concentrated level examination at the outset. So, what is happening is the number of seats have been increased. So, the standard expected by the NBE on the whole is increasing. So, how do we approach this exam is changing year by year. That's something that no one really knows. And based on a lot of feedbacks that I have received, and all of us here in the team, we have received, we are going through a few pointers so that we, up our game and then help you guys clear the hurdle like we all have done a few years ago. So without wasting much time, I'll just be is my screen visible?
Yeah, Darshan.
Okay. So, firstly, I just want you guys to understand what is the exam pattern that is going to be. So, you guys would have given your FAT exams quite recently in your second years, and few who are giving the final examination this year would have a FAT pending. Probably in the next couple of months, you're going to attempt it. So, how does that usually happen? Is that's what I'm going to go through. Most of it is common knowledge, but I'm just brushing it through so that you know how it is. So DRNB usually it consists of two examinations. One is your theory exam and the other one is your practicals. And once you've cleared both of them, that's when you get your degree. So theory paper, usually you have three papers, 100 marks each. And for practicals, again, it is 300 marks, 150 for your cases and 150 for your table, viva, etc. Okay. So the three papers in your theory exam, paper one usually consists of basic sciences and statistics and monitoring, which is the major thing that they focus on, paper one. Paper two and three usually combine systems, complication, management of specific condition. There is no hard and fast rule for this thing to be followed. Topics can be mixed and matched in either of the papers. So that there is no clear-cut guideline by the NBA telling that this is going to be there. So they are at free will to change that. Okay. But by and large, what we have noticed in the last couple of years from the FNB papers as well as the DRNB papers is basic sciences and statistics per se usually come in paper one. Uh, a lot of newer topics being included, especially from the administration point of view in an ICU, be it the organization of ICU, how do we manage disaster, especially after the recent pandemic, fire management, all of that is being included. Along with this, a new focus on AI-based management, etc., is also going to come up, along with your antimicrobial stewardship. So these are the few topics that are going to come again, and newer ones are going to be added as and when newer advances are going to be seen in critical care. Critical care, like Sir was mentioning earlier, is an ever advancing field, and we keep seeing newer and newer things being addressed. Sometimes we'll forego the old methods. Probably we have to unlearn and relearn a few things. So these things become important, if not in your theory, sometimes when you go to practicals, these questions can be asked. So it's paramount for us to be updated about the current trends. So that is what we keep, focusing on to add new and new topics so that this should be, correlating to your current trends. And probably that is what they focus on in the current upcoming examinations. So you all know very well that 100 marks usually for 3 hours and you have three papers. Sometimes they can divide that into smaller questions, be two or three smaller questions, and then they divide the 10 markers into probably 5 and 5 or 5, 3, and 2, so on and so forth. Okay. So the big question is, we all know this. So all of you would have this question in mind, right? Few of you would have a basic idea. You have completed your MD. So definitely this is not something that you don't know absolutely anything about. You do have a basic idea, but always there comes a question, have I prepared well? Is this the way that I have to go ahead for the DRNB or the DM exam? Or is this something else that I need to add on to my game? That is what you people try and think about, because at the end, it's a very daunting task. At this particular juncture, most of us do not have the capabilities to focus and study like we used to do in our, UG or your PG days. So that becomes more necessary. We all know there are multiple sources which are available, like your textbooks, be it Irwin and Rippey or Dellinger, or there are a lot of other things that are available. Case-based review, I think so. Most of you have it. Even I have read it. Everyone reads it. So this is the another source that all of us have gone through. Updates keep getting released every year in the critical care, the conclave that we have every year. Like that, we have a lot of online resources like the Internet Book of Critical Care, or MCRIT, Life in the Fast Lane, Deranged Physiology, and a lot of journals like Indian Journal of Critical Care, New England Journal, Current Opinions. A lot of resources are available. What I wanted you to understand is there's a lot which is available already, but the only question is, how do we think about addressing it, or how do we gain the knowledge from this, and how do we assimilate it and produce it in a structured format? That is what matters. I'm sure that all of you would have got worried looking at the amount of resources we have. There's no dearth for resources. There are a lot of webinars, there are a lot of videos available online. So it's not the thing that we are focused on. What is necessary and what prevents chaos, that is what we are looking at. Okay. So the only thing is, we want you to help to get a game plan on. We want you to set a routine and then help you focus on your theory exam. Okay. So the most important golden rule of a theory exam when it comes to DRNB critical care is it needs a structured, concise, and a clinical relevant approach. Okay. So this is what they look at your answer papers. They do not want you to beat around the bush. They want you to focus on a point and answer to that point correctly. Okay. And that is very important because the time is of umpteen importance. Okay, so the primary aim for all of you is to maximize your score and make your answers appeal to the examiner. They need to be examiner friendly as well. So this is how it is going to be, because in a recent meeting that I attended with the NB, what we got to know is there are dearth of examiners who are there for correcting the theory papers. They actually take some time. Okay, no one has a structured format. Previously, we were given an answer telling that there will be a key answer, based on that it will be corrected, but there is no said rule like that, and things keep changing. But there is no exact source for this, that this is how it is going on. This is by word of mouth that we have got to know from a few of the examiners who have corrected the papers. So that is what I'm trying to tell you. So by and large, if you have a structured answer which is answering to the point which has been questioned about, your chances of getting a better score would be higher. So then the most important question, how do we approach a question when it comes to the exam? Okay. So always understand the question, read the question once or twice. Okay. Look at it, break it down. If it is divided into set marks like 2, 5, and 3, it might be divided because it is asking some definition, classification, and management. And then you need to answer only to that much amount. Okay. You need not write various definitions. Sometimes there'll be multiple definitions based on different societies. You cannot go on writing all the answers like that, because the answer they're looking at is probably a single or a two-liner, and one specific society, whichever you know, can suffice you to get a mark there. Okay. So that is what you need to look at it. So you need to look at your question, understand the question, break it down, and allot or allocate the specific time for that particular question. time management is necessary. Just because you know a particular topic, you cannot go on answering it for 10 minutes. Okay. So you need to reduce the time as early as possible. Probably if you know an answer well, you will be spending lesser time in writing it because your brain already knows it has a roadmap. It will give you the answer and you can jot it down quite quickly. The only question is when you can answer a question which you already know, use the spare time which you have saved in the question you know to the question you do not know, so that you can formulate an answer and then save up to the missing time. Always remember, you need to keep some spare time in the end, probably around 5 to 10 minutes. That's the good thing that you can do, so that you can add on to the points which are missed earlier when you were writing. Definitely, if you read a topic, you cannot reproduce 100%. Always there will be a gap of around, say, around 70%. If you're produced, that's excellent. So if you're missing those points and when you review your answers, probably you'll remember 1 or 2 points later on and those can be added on. That's the reason I always suggest that you wait for that particular 5 or 10 minutes in the end so that you can review your 10 questions. Very important thing that you guys have to know, DNB or DRNB actually asks you to answer a particular question in a designated page. So you cannot answer question number 1 and page number 5. Okay, they have an allocated page number. Says like question number 1 has to be answered between pages 1 and 5. So you need to start question number 2 in page number 6 itself. If you have a lot of space available in page number 5, or you finish the first question in page number 4, you're not supposed to start it at page number 5. Okay, I do not know the reason for that, but that is what has been given in the instructions manual when you start any answers. Okay, so always presentation matters. So probably that is one of the reasons they have it in a specific format, and that's the reason they have designated pages. When you have a question, use headings when you answer it. Okay, so that shows that you are structured in your approach, then you have thought about it as a clinical scenario and you are approaching it as a real life patient. Okay, that is what matters, and probably the examiner will be impressed. And obviously not all of us have good handwriting, so if your handwriting is good, excellent, I think so half your problems are solved. But for the people who have a little not so normal handwriting, probably they, if they use a certain technique like heading, spacing out, underlining a few important points, so those will get you better marks as compared to the others who are blessed with good handwriting. Okay, always remember points, pointers, application of tables, flowcharts, and diagrams always carries more marks. So whenever possible, if you have time available, please draw a few diagrams, or approach your answer in a flowchart manner. So that will help you get more marks. Okay, so spacing, handwriting, all of this is something that we cannot change at this point in time. But yeah, if you can improve your presentation, that probably might get you some brownie points. So the structure of a good answer, usually whenever you have a question which has been asked, probably if it is specific disorder or a procedure of management, usually you need to start it with an introduction. Even though it is not asked, you can spend 30 seconds to 1 minute to just write in what is the introduction for that particular topic, and then you can start off with your major part, that is the question which is supposed to be answered. So whenever they ask a question about a disorder, probably start under the headings of definition, probably risk factors, pathophysiology, clinical features, investigations, and management. In management, please don't forget, the monitoring and complications as well. What we usually think about in management is the investigations, and then we go on to write on the medications, and probably for surgeries indicated, we'll go to surgical aspects. So what we usually forget is the complication of that particular disorder or a sequelae of few disorders. So those, just the headings would get you some marks. Then again, firstly, you need to answer what is the question asked, and the other things when you're writing, probably they will fetch you more marks if at all you have a time in the end, and then you can add on these points. And if it's a procedure related problems, please categorize it. Procedure, especially patient related or technique related. Okay, so you can divide the question and then approach your answer. I know most of you already would have learned such techniques for your MD exams, but this remains the same even in this particular examination. always remember when a question is asked about a clinical scenario, your ABCD is something that is supposed to be answered. Make it a habit, because this is something that will be asked even in your practical exams. So if you approach that accordingly, then it will be easier for you to answer. You need not write everything in detail. Probably you say vitals will be stabilized. In your theory paper, you can write just one word on this. After that, don't forget to write the evidence-based guidelines. Just write about the recent evidence, whether there is positive evidence or what is the level of evidence that is available. Okay, whether there's something that we need to retreat, or that is something that has to be mentioned and underlined. That will definitely carry some good extra points for you. Don't forget evidence. Okay, it need not be that you'll remember everything, but at least the major things that we will be discussing in our classes, that those, if you write, I think that should suffice. So how do you prepare? There is no specific method. You will have your own method. What I would suggest is to follow that. But if you do not have a method, probably what I would say is a 4 to 5 month period would be sufficient enough to prepare for the upcoming theory examination. You need to choose your methods carefully. Depends on your work schedule, whether you're an early riser or a late owl. So it depends on how you work on, and how do you read. Okay, so you need to choose a method and stick with it. So that is the only way to go forward. You need to make notes. There is no shortcuts. I know a lot of you, including me, I had difficult times making notes. If you have notes available, or if you have articles available that can help you with some notes. What I used to do is I used to take a reference article or a review article, and then I used to add on points. And then again, I had a lot of help from my seniors. So if your seniors are there, you can ask them if they have made any notes, and if they're willing to share, you can use that as well. So this is something that you need to know. Have some notes so that the anxiety level which increases during your exams come down. If you have something that is written by yourself, you will have some amount of reassurance when you're freaking out. So that is one major thing, and definitely it will make your work a lot easier when you need to revise. Revision is very important because it's most often neglected. We actually catch on a train thinking that the journey will end only in the exam, but having said that, we forget that revision becomes almost negligent in the end, because we forget that we cannot remember and recall a lot of things. If we have to recall most of the things, we need to revise. Probably the best way to do this is in your tea breaks or your coffee breaks. Discuss the answers with your juniors. Teach them a topic when you have learned. Probably even your senior faculty, if they're willing to share with it. There are a lot of things that keeps changing. The evidence keeps changing. If you discuss with your faculty, that will be a very good discussion, and then they will learn, and then you also can have a discussion and probably end up learning more. So that is one way of revising. So another thing is always have group discussions. If you have a good enough academic program in your hospital, great. But if you do not, form a group among your peers. If one or two of you are there, that should be enough. Present a case to each other and then discuss about it. You will always have resources. I've mentioned you, a lot of resources are available. The only way that you can go about is you discuss these cases and then come to an understanding. So if you have some doubts, then always there are people to help you around, be it your seniors or here if you're in the classes. We guys are always there to help you around. So in the end, I would always say this, okay, hard work definitely pays, but smart work is always the one which rewards more. Okay, so I hope that you work smart, because time is of the essence, right? So thank you. If there's anything, if feel free to raise your hand. Bhageshri will unmute you and you can talk to me, or else you can type in the chat box and then we can discuss. And next, we have Tapas sir again presenting a format of the presentations that we routinely take in the top class. This is just a sneak peek into the classes that we are planning to do. A lot of people have benefited from the classes like sir was mentioning earlier on. So we have learned a lot from these classes and we are trying to improve as it progresses. So we are also learning. So that is how we plan to focus on the upcoming theory exams as well.
Yeah, thank you, Dr. Darshan. So before starting, I would request Dr. Srihari and Dr. Bhuvneswari and Dr. Niharika to please share something so that the candidates will be at least wiser. And in the meantime, I am getting my presentation ready. Anyone who like faculty side wants to share something to the candidates?
Clear is on.
Nothing. Good evening, sir. Nothing specific, sir. I think Darshan has covered almost everything that needs to be discussed. The only thing I would like to emphasize on is the candidates need not be worried. So, if they have at least 3 to 4 months of adequate preparation, I think that would suffice in getting a good score for the theory.
Exactly. Thank you very much, Dr. Srihari. And Dr. Niharika, Dr. Bhubneswari, anything from your side?
Yes, sir. So, hi everyone. So, I'm Dr. Niharika. So, I think Darshan covered almost everything. So, my request is so you actually, this is one of the guide for you people. Okay, when we were giving our exams, we didn't know what to read, where to read, how to write. We didn't have any idea. But at least now you people are actually having some guide. Okay, and I know most of your people will be managing almost all of your cases. But when it comes to the theory, then you'll come to know, yes, what to write, how to implement it. So you should know everything. So this is an art. Theory exam is basically an art. Okay, so you should know how to write it. Okay, and if you're joining the course, my advice is, so please attend the live sessions, and secondly, try to complete the topic within 2 to 3 days of whatever we tell you people. Okay, because just don't keep it for the last moment, because you have to revise these topics. So please start. You have, this is only 4 months left. Start from today, prepare a schedule, and I think that will actually help you the most.
Thank you, Dr. Niharika. Dr. Bhubneswari, are you there?
Yes, I'm there.
Yeah.
Welcoming all for the top program. So I would just like to tell, as Darshan sir covered most of the things, if you are joining the top program, start from day one, keep listening to the live classes or recorded classes and finish it within time. And definitely write the mock exam, because last time many of the students were telling like we missed it, we couldn't finish the paper within time. And the mock exams from the top course will definitely make you like what to say, it is a practice exam for your main exam. So I would suggest not only listening to the videos but also writing the mock, whether you know the answer or not, will help you prepare for the exam thoroughly.
Perfect. So I would say top course is a panacea for all of you to get past this difficult exam in your life, and this would be something very helpful, I would say. And but this is not everything, because you have to prepare on your own, make your short notes, and the style of writing also differs from person to person. Okay, so there is a question in the chat box. Yeah, Darshan has already posted. Perfect. So I will not answering those questions. So with this background, I am just trying to share with you a question and how one should be answering this one. So this is a very much, I would say, prototype. Don't think that the questions would be written in the same format, all the questions, but it's one of the prototype how you should be writing and how your concept would be cleared while you are actually participating or attending our live or the discussions and webinars. So I have tried to make it little bit of interesting by only writing the answers, not like no exclusively describing the detailed, because this would be something not very much appropriate for this exit examinees webinar. So if by question very commonly asked in Indian setup, I would be saying, as you are appearing for like no our DRNB and DM, so definitely there would be 75% chance that you will be getting a question on the environmental hazards or poisoning, and out of that OP poisoning would be the first, which is a preferred one by any examiner while selecting the questions. So OP poisoning, if a question would be asked, so people may be knowing a lot of things, but the real DRNB or DM exam nowadays, they are actually specifically asking about some sub segments. So it would not be write a comprehensive note about OP poisoning. No. So there would be 2 to 3 segments of the OP poisoning. So if it would be a 10-mark question, so definitely there would be two sections or stems in that question. So as we have like right now taking this as a class, so I would be making it little bit elaborative. At least this class would be helpful to start your preparation from day one. So take it as the pre-webinar day rather than the first day of your preparation. So I have tried to make the OP poisoning based on the 5 questions that can be asked. So any permutation combination the examiner may ask you. It's not like only the pathophysiology and clinical feature. They may be straightforward asking about how is OP poisoning diagnosed and what are the key laboratory tests and how you are going to manage a case of OP poisoning. Maybe there would be a one sub-segment of 3 marks. What are the complications, prognosis, and recent advances? That may be also asked. They may be asking you about the pathophysiology of OP poisoning and how does it lead to a cholinergic crisis. So that also can be a question. So 5 plus 3 plus 2, something like that also can be asked. So I'm just trying to get into the proper way of answering the question based on the sub-segment question. So the first one, explain the pathophysiologic principle behind the OP poisoning and how does it lead to a cholinergic crisis. Can anybody, I just want to like know, are we in the same pitch or pace and everybody is with me? So any smart answers from these smart people like all of you? You can post in the chat box. What is the pathophysiologic principle? Just in 2-3 words. And what is the principle behind that it would lead to a cholinergic crisis sometimes? I'm unable to see, but yes, you can post in the chat box. Anyone? Or you are not expecting that the webinar would be also asking questions to the candidates? Okay. No worries. Just to like make it interactive, I just asked this question. Anyway, I'm sharing you the answer. So organophosphorus compounds, the basic principle, the pathophysiology is it is inhibiting the acetylcholinesterase, ACHE. And that is the enzyme responsible for breaking down acetylcholine at the cholinergic synapses. It is the principle. Now this inhibition that it is actually breaking down or the inhibiting the acetylcholinesterase that leads to excessive accumulation of acetylcholine. So there is actually more than what is required acetylcholine in our the different receptors, and that is resulting in overstimulation of not only the nicotinic or muscarinic, rather than it is also affecting the CNS receptors. So there is overstimulation of muscarinic, nicotinic, and CNS receptors. So this is in one line, you can actually describing the pathophysiology behind the OP poisoning. Now, there are certain responses or effects of this pathophysiology. So you can again divide into muscarinic effects, nicotinic effects, and CNS effects. So muscarinic effects, it would be all related to the secretions, over secretion, because acetylcholine would be overstimulating the secretion. So bronchoria, bronchospasm, meiosis, lacrimation, salivation, diarrhea, heart rate would be less. So bradycardia, hypotension, urinary incontinence. So it would be all systemic. So you can remember from top to bottom what would be the muscarinic effects. Now in the nicotinic effects group, you will be getting all at the end of the muscle plate. So it would be muscle fasciculations, cramps, patient will be complaining of weakness, finally resulting in respiratory failure or paralysis. Now, if the toxin or the OP poisoning is actually affecting the CNS, so there would be anxiety, agitation in the form of seizures, coma, and respiratory depression from the central origin. So these are the pathophysiology principle and the pathophysiologic effects. Now, the mechanism of all these things, like no, the acetylcholinesterase inhibition, why actually it is inhibits and actually it is resulting in all the crisis or all the symptoms or signs. OP is actually binding to the serine hydroxyl group. Serine hydroxyl group at the active site of the acetylcholinesterase, and that would be forming a stable phosphorylated complex. And this phosphorylated enzyme now is irreversibly inactivated unless you are giving or you are actually counteracting rapidly with oximes. That is the pralidoxime. That is the basic principle of giving pralidoxime as early as possible before the aging happens. Now, aging of the phosphorylated enzymes makes the inhibition irreversible. So there is actually a time period or time window during which if you are giving the pralidoxime, that would be helping to again dissociate this enzyme from this phosphorylated complex. Like no, that stable phosphorylated complex will be dissociated. But if you are unable to give pralidoxime in the correct time window, the phosphorylated enzyme becomes aged, and that would be the disaster for our patient management, and that would be making our early intervention critical. Now, if you are taking the next question as what are the clinical features of the organophosphorus poisoning? Now, organophosphorus poisoning, it would be, again, I have already described muscarinic. So just like, no, you can remember the acronym dumbbells or sloth syndrome. So dumbbell, it would be diarrhea, urination, meiosis, bradycardia, bronchoria, bronchospasm, all the three. B, emesis, lacrimation, and salivation. Now coming to the nicotinic effects, again described muscle fasciculation, weakness, paralysis, and respiratory muscle involvement. CNS effect, anxiety, agitation, confusion, ataxia, seizure, and coma. Now, the examiner may ask you, like this is a very commonly asked question, OP poisoning. So classification of the severity. So you can remember in the form of, this one is like the POPS. So you can like remember in the form of mild, moderate, and severe. Mild is just only muscarinic symptoms. Patient is fully conscious. Now, if you are discussing about the moderate, so it would be nicotinic symptoms, muscle weakness, and fasciculation. So it is paradynia OP poisoning classification. So maybe some examiner would be asking not only if you are like asked in the theory, but in practical also during your viva also, they can ask you how can you classify the severity of OP poisoning. Now coming to the severe form, it would be CNS depression, seizures, respiratory failure, and coma. Now the next part would be how will you diagnose OP poisoning? So again, you have to divide. Always remember as described by Darshan as well as Bhuvneshwari and Srihari and Niharika. Every question that you are getting, you should not be writing straightforward with like very elaborate sentences without a structure, because the examiner hardly gets how much time I don't know, but you are getting only limited pages to fill up the answer, like the question with the correct answers. So it should be very impressive also. Simultaneously, you should not miss the important things by just starting with very aggressively, but at the end you are actually running out of like the space, you are running out of ideas, and you are running out of like the flow somehow missing in the like middle of the question answer. So that's why always have one structure in your mind. And in our top theory preparatory course, I would show you, there is another presentation where I have also described the OP poisoning, but this time I thought of like again dividing this OP poisoning into 5 questions and then again answering. So you should be having something called as the mind tree, or the questions would be having in one page also. You can, if the examiner would be asking and there is space constraint, you can write about a 2 page in only one, like I would say one table or like one tree like thing. So that we normally like put in all of our the theory preparatory course classes. Every question would be having something called as the mind tree. So in that, the questions would be again divided into the different sections that you are trying to answer, and those branches of the tree would be the one segment of answers. So I would be describing this or showing to you also. Now, coming to the diagnosis of OP poisoning, the key laboratory test, because the examiner would not be very interested to know in detail about what you know about the plasma cholinesterase level. So they would be only expecting you to write about these highlights of the answers. Plasma cholinesterase level markedly reduced, not reliable for acute assessment due to it is a delayed response. Then RBC acetylcholinesterase level more accurate, but hardly we are getting this test report in our respective centers. Then ABG, because ABG would be showing respiratory acidosis, hypoxia because of respiratory muscle weakness and paralysis. X-ray, there would be if the patient will be drowsy because of the CNS effects. definitely patient will be presented with aspiration pneumonia, or maybe patient will be presented with pulmonary edema. Electrolytes, hypokalemia due to the muscle damage, creatinine kinase if elevated in severe cases with muscle damage. And diagnostic, if the patient presents with altered sensorium, had seizure, and then suffered from hypoxic ischemic injury, so you will get all the sequelae in the brain CT or MRI. Now, how will you manage this type of case? Always remember, when you are getting a case, the question, how you are going to manage. Always you can divide into initial management. I'm just going into specific therapies and supportive therapy. Always your answers can be divided into these things so that you are not missing the most important things. Because in critical care and emergency medicine, you are expected to do the initial ABC always. Any patient coming to your emergency or ICU. So you will be always right if you are writing about this initial management. And in this, everything related to A, B, C, D, E, how we are normally tackling in our day-to-day assessment. Now, there would be always some specific therapies for very specific clinical cases that you can always keep in the specific therapies. Like in OP poisoning, it would be atropine, pralidoxim, and specifically if it is seizure, agitation, benzodiazepine, and patient is going into respiratory paralysis, advanced critical care support. Now, supportive care, as I have told, you have to always, these are only one-liners. So you are not expected to explain in detail, because we don't know what will be the fluid electrolyte balance in a specific case. So you can always say that I will take care of the first hug BIDS or whatever, we normally do, because that also the examiner sometimes expects you to know, because most of the things in critical care not having very definitive therapy or antidotes in the poisoning case. You have to support the patient till the normal homeostasis takes over. So that is the fundamental behind expecting this thing in your answer also. And it doesn't take much of your space also in the exam. Now, just to go for as we are discussing initial management, most important thing would be decontamination in OP poisoning. Removal of the contaminated clothing through washing of your skin, airway protection, IV access, fluid resuscitation, specific therapies. I'm not going into detail in this class, but yes, we have to write 2 lines. Atropine, what is the mechanism of action? What is the initial dose? And what would be the the signs and symptoms of the atropinization? Now then, coming to the pralidoxim, what is the mechanism of action and what is the dose? Benzodiazepine, advanced critical care support. Now, coming to the supportive care, again, we all know these are the something what we do, what are the complications, what are the prognosis, and what are the recent advances, which is in the form of the bioscavengers or some of the novel oximes, that is also apart from pralidoxim, which has come in the market, obidoxim and HI6, enhanced detoxification techniques, and precision medicine approach, because nowadays OP poisoning also is going into the form of the phenotype and the genotype of the patient. So that's why if you know the genetic susceptibility, so the precision medicine approach would be helpful for the specific group population of the OP poisoning affected patient. Now with this, I am just stopping this presentation, and I have also the one more presentation where I have discussed last time. So I would be now sharing with you in maybe 5 minutes of time. In the meantime, Darshan, if you want to share something.
Yes, sir. I think so. The candidates have seen how a structured answer looks like. So, like you have pointed out, and we have already mentioned earlier, structure is what matters, and how you, when you read a particular topic, when we ask you to make notes, this is what we ask you to do. You have to write down these pointers in a way that you have understood better, that you can recall. You need to have some keywords, so if you underline your keywords, probably it will be easier for you to recall when you're revising. So this is what we look at any question. So look at a question, think about the keywords in the question, and based on the keywords, you'll be able to formulate an answer and recall the maximum.
Perfect. So just for the sake of, I think you have shared what does the papers come like, paper 1, paper 2, paper 3. So
Yes,
these
sir.
are the
Yes.
basic
Yeah.
outlines you have shared, and
Yes.
we all know that many of you are stressed, and I am very sure that few are about to be after attending this free webinar tonight. I think many of you will be having nightmares also, that how I am going to finish such vast topics, critical care in the next upcoming 4 months. So we are about to increase your sympathetic stimulation. And also there are certain group of students, they have prepared well, but they are not very sure that they will be answering it well on the date of the examination. So for that, we also know that you have not appeared any theory exam where you are expected to write 20 pages or so in last couple of years after passing your MD exam or the the concerned other exams. So definitely we have to be very precise in our preparation, as well as the these are all the things already discussed. I am just trying to share the one or two slides. Sometimes no, the answer comes in this form, and the examiner normally no, doesn't be get no, impressed with the way you have explained in detail. Rather, it has to be very structured approach, and that's the reason why I have already described. So this would be the mind tree. In this, you can keep everything in one slide. So the purpose of keeping this slide is that the clinical features is here, symptoms and signs are here, classification is here. Then going into the next page, the different manifestation, it is exclusive. So I'm not saying that you have to make it so busy, but yes. So this is like something which you can keep in mind and you can just copy on the paper. I'm not going into detail. And the management. So you can just keep it like this. The management, I have already discussed termination, airway control, immediate aggressive use, all these things. But yes, it has to be mild, moderate, severe. I have already given you this classification. So you have to know the format and what are the pharmacological treatment. This, if examiner is asking about, to draw the diagram, how the pathophysiology happens and how your management is actually affecting. So you can draw it. Always keep one or two diagrams ready for every question, because that sometimes gives little bit of edge over. The examiner gets impressed rather than only the writings. If you are drawing something just to create that impression that you have understood, and the space would be also less if you are actually trying to draw a 10 sentence or 10, I would say no, half of the page only writing and a small diagram explaining the whole thing. Okay, so to summarize, look, read the question completely, look for the subdivisions, answer to the point, use diagrams when necessary, and make it crisp and impressive. Thank you very much. Now, how do we ace any exam? Already, these are the things that Darshan has already explained, but practice, practice, and practice. And for that, you have to have some strategy. And again, on the date of exam, you have to again have some other strategy, how you are actually performing the best of your capability. Now, with this, I'm trying to give you 2-3 minutes of how we are coming up with the top course. So this is a systematic and organized approach to the exam to alleviate the stress, and personalized approach by our the core faculties who have recently concluded this DRNB exam, and they are very much experienced, and we have done this type of course for last couple of years. So we know what is actually expected from the candidates. Now, also simultaneously, we don't want to bombard you with so much of information. Rather, we want to make the learning joyful, and examination should be just another day at work. So that should be the approach. And we bring the experience of the previous courses to make this exit exam stress free. Now with this, I want to share with you the agenda of our course. So this course is for 4 months, where we will be taking weekly classes, and this would be from May to August. But yes, the course validity or the access, the subscription would be lasting till the date of your theory exam. Date of your theory exam you are finishing, and the subscription ends there. And DRNB, DM, critical care medicine residents are actually the prime focus. But if somebody is doing IDCCM, IFCCM, want to know the critical care, they are very much welcome. It would be weekdays, and depending upon the there would be certain changes that would be informed also. prior only. Study material to be provided prior to class. So we have collected the resource materials, articles, review materials, some of the previous batch, whatever the very short note, crisp notes that we would be also sharing, but it would be depending upon that topic or domain. There would be question and answer pattern. So we have like almost 100 to 120 questions from last 7 to 8 years, and again very relevant questions. It would not be outdated questions, and we have tried to make it domain wise and what the question wise the answers. So that would be discussed. So domain oriented conceptual classes, mentored classes with personalized approach, and at the end there would be grand mock test with simulated real paper type. We will be encouraging you to answer it on the the blank paper, share with us, scan it, and then our examiners would be assessing, give you the real the feeling of how much you are getting in the mock test. So you will get to know that where are you at the end of this 4 months course. And there would be a dedicated WhatsApp group. Every day if you are preparing something, you have any doubt, you can post it in the group. Our faculty would be helping you, your peers would be also helping you. So it would be something interactive. At the same time 80 to 100 people are actually preparing, so you are not left behind, you are not alone. You don't feel that nobody is there to guide you. So this is something, a mentoring class, mentoring group, where everybody is benefited at the end. Now, this is just in short the 100 plus topics to be discussed. May to November we have written. This is just the access duration. So it would be, if you are starting from May 15, so it would be ending after the date, once your exam is over. Now, May it would be cardiology, endocrine. June, pulmonology, neurology, hematology. July, hepatobiliary, nephrology, obstetrics, sepsis. In August, metabolic, toxicology plus trauma. There are a lot of miscellaneous topics, so we have just given you highlight of the main miscellaneous topics in the form of end of life care, communication, then basic sciences and biostatistics. You are definitely going to get questions from these two topics. And in the September month there would be mock test and live debrief of the mock test. So this is our plan. So we have done this one 14th May, still continuing. And these are some of the the concerns, specific informations for how to register. And we are happy to take any of your queries now. Thank you very much. Anything you want to add, Darshan or Bhuvneshwari,
Thank you, sir.
Srihari?
I just saw a question in the chat box by, I think so, Dr. Anjum. She has requested, telling that few of them have exams in June. This course is focused on the people who are going for exams primarily in the month of October, November. So it's really difficult for us to complete a lot of questions within a span of a month. That's going to be really difficult. But having said that, we really don't know the dates. I have to look into it and we will see if we can help you in any other way. But this program is focused on the candidates who are giving the exams towards the end of October, probably in the first week of November. That's what it is thought about. For June, we have to regroup and think about it. We have to still think.
Darshan, for Sajia, don't worry. You have your exam in June. So we have the recorded version of everything that we have done in the previous batch. So if you are close to your exam and you want some support, so please contact me or Navneet. We would be there to help you something. Don't worry. Okay. Don't worry, Sajia. You will get everything also in short span of time. We will try to help you.
So I think so, sir has covered most of the things. The only thing that I wanted to share is we will be starting with the cardiology sessions soon.
Yeah.
Is my slide visible, sir?
Yeah. You have started screen sharing. Yeah. Yeah.
So this is the cardiology agenda that we have. we are planning to start it a day earlier itself because of want of time. In the schedule that we have mentioned, we wanted to cover both cardiology and endocrine, but given the list of topics that we have in cardiology, we might have to push endocrine into the next month, and then we'll be able to squeeze in endocrine as well there. So the primary focus of this 15 days from today would be on cardiology. We'll be starting on 18th of May, that is a Sunday, by Dr. Srihari. These are the topics that we have curated for cardiology. The focus is these questions have been asked earlier as well. What we usually do in any of our sessions is, if at all a question has been asked in the previous question papers, it will be mentioned what is the question, and the answer would be based on that. And then in the end, we will also add on a few other pointers as a follow-up note. Probably they might be asked in the upcoming exams. So every time it cannot just be, if they're asking pulmonary embolism, how do you manage pulmonary embolism? That just wouldn't be the answer. They might ask you about catheter-directed therapies or PE with pulmonary embolism with cardiac arrest or something like that. So if at all it is asked like that, how do you go about answering those questions? So that is what we are looking at. It is more or less anticipation of the forthcoming exam with the previous exams patterns. So that is what we are looking at. So this is by and large the agenda for cardiology. Every time that we have a new topic coming forward, we will be releasing the agenda, the date and time and the presenter, as well as the resource materials. Resource materials would be usually provided 5 to 6 days prior to the class, as early as possible, and they will be in a separate folder. You will be given access to a particular drive, and that you can access all the recorded videos as well as the PDFs of the resource material. So that is what is going to be done in the courses of henceforth. Any questions, feel free to add in the chat box, or you can raise your hand and we can talk. So by and large, this webinar was focused on what you guys want to know. You would have definitely heard from your seniors who have completed. You will have your own queries. So if you have any such doubts or you want to talk about anything, please feel free to unmute or text. So this is something which is focused on you guys and what you want. So please feel free to speak.
And the clock is ticking. So start getting more serious towards your theory exam preparation, because you will be hardly getting 3 months or so. So start using the time, whatever remaining time, in a very wise way.
So the registrations are open for the class, so you guys can share around, think about, talk to your peers, and then decide to join the course.
Yeah, one salient feature I want to share, as we have already shared the screen. So if because DRNB and DM, there are many candidates in one hospital or in the city. So if they want to join in bulk or group, so definitely there are very I would say encouraging and motivating discounts for them. So try to get the early bird discounts as early as possible. Yeah. Okay.
Anything else from any other faculty? I think so. They can also share. Niharika ma'am, Srihari, Bona.
Nothing, Darshan. I think almost everything it's been discussed.
Mostly it's covered.
They are getting ready to start teaching you. So that's why they are focusing on the teaching part rather than the description part. So Darshan and myself are busy in the description part. So they are all set. All the faculties are all set. Now the course is about to start. Yeah.
We have learned a lot from the last two batches. So what we would suggest, like Dr. Bona and Dr. Niharika were mentioning earlier, is prepare from the starting.
Yes.
Don't keep things till the end. Please make notes as and when the classes are going on. So in the end, everything becomes a little chaotic and you guys get flustered, and that will make you lose more time. Again, the productivity goes down. So start from day one, do as much as possible. Probably you can go back and finish it So like one of you were mentioning, how many topics do I have to complete per day? It depends on how your availability is. If you're having night shifts continuously for 2 to 3 days, probably you would want to rest the next day. And I wouldn't be expecting you to study even a single topic on that day, because humanly it is impossible. But if you are able to squeeze in some time in between, read a small topic, that's really great. So it depends on person to person. So you need to formulate such plans, which is going to be your way of approach. No one can actually give you a topic or a personalized timetable. That is something that you guys have to do based on your free time and your way of preparation for the exam. So if there are no other questions, I think so. Can we call it a day, sir?
Yeah, I think so. So thank you very much, and waiting all of you to join, and we would definitely have a great time helping you out. Thank you. Thank you all the faculties and all the attendees who have joined despite your busy schedule. Have a great day.
Thank
Bye.
you.
Thank you. Thank you,
Dr.
everyone.
Thank you. Thank you.
Thank you.